Ladies and gentlemen, distinguished participants and audience. First of all, I would like to thank you for the award committee for this distinguished award I got 2 weeks ago, and I would like to share with you my presentation on this paper. The title of the paper is the following: Promising European Research Results to Improve Hospitality in Healthcare by eHealth. I share my PowerPoint. So the authors were Fanni Zsarnocki-Dulházy, Martin Zsarnocki, Bence Kopper, József Kárpáti, Csilla Molnár, Gogo Fredrik Collins Adol, and me, Lóránt, Dénes, Dávid. I work in the John von Neumann University and the Hungarian University of Agriculture and Life Sciences in Hungary. And we submitted this paper last year, the tertiary of the year. And I would like to thank you for the reviewers, editors, everybody who helped our work. A short introduction. There is a close relationship between the assessment of care and patient satisfaction and the term hospitality. Based on PISM 2020, the 5 dimensions of hospitality organizational culture in the healthcare setting are patient-clinician interactions, patient support, staff interactions, workplace climate, external stakeholders relations, and facility atmospherics. In Hungary, the efficiency of public medical treatment is limited, and consequently, patient experience is quite low. Possible 2 main factors are healthcare structure and operating model, and other is the increasing demand for care due to increased life expectancy. In terms of the operation and structure of the health sector, underfunding is a negative influencing factor, which means limited resources for hospitals and healthcare institutions, and also low salaries for healthcare workers. The infrastructure is obsolete, which is also shown by the fact that there was complete chaos during the COVID-19 epidemic situation. A complete reorganization of healthcare was necessary, which meant that some departments were temporarily completely closed and COVID-19 departments opened instead. This desperate situation leads to the question how can the quality of hospitality in healthcare be increased? About the theory, the main factors which currently complicate public healthcare are outdated infrastructure, underfunded healthcare, a large number of career dropouts, and increased life expectancy. We believe those phenomena could be treated in the shortest possible time and with optimal efficiency without complete restructuring with two measures. Digitization and the fourth industrial revolution, which is spreading. The use of new digital technologies in healthcare that support administration saves time and is cost effective. The key factor of which is personalized care similar to hospitality guest orientation and satisfaction processes. In this study, healthcare, tourism, and hospitality professionals work together to get a better understanding, analyze the results, and provide recommendations. About the materials and the methods. Our research team of university professionals consists of one expert in healthcare, one university professor who is experienced in global medical tourism, one associate professor who gained expertise in rehabilitation, one associate professor who deal with state supervision of healthcare, one university professor and an associate professor with 30 years of research experience in health tourism processes, and a PhD candidate who is focusing on similar problems in Africa. This research note uses and reflects on the author's previous research works, implementing cultural understanding in a customer-oriented manner, and proving a state-of-the-art approach to the topic. There are several ongoing research programs based on the aim of the university course to incorporate the students into the healthcare system to address the cultural misunderstandings among experts and other stakeholders. Also, the English language expansion of the program is under development to incorporate students in neighboring countries struggling with similar healthcare problems. The program specifically addresses the challenges in the geriatric gerontology field where specialized treatment is compulsory. Our results. The study is based on the mandatory eHealth solution that is used by the public and private health institutions in Hungary. The national eHealth infrastructure, EEST in the Hungarian language, was established in 2017 with the support of the Ministry of Human Capacities, but its use was not widespread among healthcare workers nor among patients before the COVID-19 outbreak. Patients can have their e-profile, which includes prescribed prescriptions, referrals, and medical documents with presupposes a kind of personalization, but it still does not solve the lack of trust and attention that patients expect from their doctors. However, if the time spent on administration is reduced, the patient-specialist relationship can be more personal and deeper. In practice, this does not provide a spectacular solution that would be necessary to incorporate additional eHealth technologies. The simplest and most obvious solution is the involvement of the available audio-visual systems, as it could help with patient-doctor communication and support maintains continuity of supervision and treatment remotely from a distance without traveling, thereby reducing the burden on the medical staff and overcoming the distance. There are numerous developments currently throughout the world, and this help is inevitable shortly. Robots providing home supervision and companionship. For example, Paro therapeutic robot, giraffe telereference robot, uh, uh, wearable devices that measure vital functions, for example, Fitbit, Chronos system, etc. Devices suitable for home screening tests, for example, cardiomobile, EKG, EKG at home, smart glucose meters. Besides the good features of eHealth, we have to deal with its negative side as well, since we may encounter language barriers during its use or other user shortcomings. Although telemedicine has flourished during COVID-19 and its use has advanced in many European countries, there are still significant gaps in the regulation of telemedicine. Self-diagnosis of diseases without a professional can be extremely dangerous. Excessive use can also lead to cyberchondria. In addition, we have to take into account data protection and privacy settings. We compiled the SWOT analysis. You can see the strengths, the weaknesses, opportunities, and threats. Strengths are the following: cost effectiveness, promotion of health equality, ensuring continuity of care and supervision, prevention of the spread of disease, for example, COVID-19, home care assistance, accessibility, and administration purposes. Weaknesses are the following: language barriers, misinterpretation of technical language terms, e-skills must be increased in all age groups, the necessity to increase the offer of services. Opportunities, the quality of care improves, patient satisfaction increases, waiting list decreases, support personalization. And finally, the threats, cyberchondria, false self-diagnosis, data and privacy protection are extremely important. Continuing the SWOT, strengths, deep knowledge about overall rehabilitation, unique knowledge about technical innovations that can support health and healthcare, sport and medical rehabilitation as well. Weaknesses, many types of innovations on the market, not certain that specialists will be able to acquire knowledge of all of them. Lack of prior knowledge about the profession and acceptance by the part of the patients and specialists. Financing difficulties may arise when purchasing a specific device. Opportunities, involvement not only in the sports field, but healthcare. The workforce shortage in healthcare can be reduced. And threats, if there is no continuous training due to the rapid development of technologies, even the new technology used may become obsolete. And the conclusion, this paper and this study present interconnected solutions to the reader, eHealth solutions, and the new university-level health-related course where new rehabilitation experts are trained to support hospitality in healthcare, in hospitals, and also at home care. During the digitalization development of hospitality services and products, employees with digital competencies are needed to manage new technologies and can ensure high customer satisfaction as a result of the use of digital tools. Similar to digital development of hospitality, re-examination of the previous results and the comparison of the current results in a SWOT table summary suggests that eHealth solutions could play a major role in customer-oriented healthcare hospitality in the future. However, tool development and innovations alone are not enough. The system also needs human resources who know and are able to use them confidentially and properly. This is why the Hungarian University of Sports Science created its master program. During the training, in addition to getting to know the musculoskeletal system and complex rehabilitation processes, great emphasis is placed on the state-of-the-art motion analysis instruments and systems used as a practice in elite sports and other digital tools supporting rehabilitation. So it was the abstract and summary our paper. I hope our results will be useful not only for Hungarian healthcare but internationally as well. Thank you for your listening and attention. Goodbye.